I was born and raised in El Salvador. My mom was a nurse when we were growing up, and she always wished to pursue medicine, but was unable to. So as a child growing up, she always kind of nurtured that side of her, I guess, that she couldn't accomplish, and it just kind of instilled in me that desire to pursue medicine. Part of that, I also fell in love with biology and just learning how systems work, and then compounded by the desire to help people, kind of bundled everything together, and medicine just kind of fitted everything. My name is Dr. Madeline Torres, and I'm a surgical oncologist at MD Anderson Cancer Center at Cooper. My practice mainly revolves around general surgical oncology, which encompasses a lot of the gastrointestinal cancer. So I see a lot of patients with pancreas cancer, a lot of patients with gastric cancer, a lot of patients with small bowel or liver cancer. We also see patients with skin cancers like melanoma and other types of cancers that arise from muscle cells or fat cells like sarcomas. Cancer care is a team sport. We work in combination with the medical oncologist, the radiation oncologist, pathologist, radiologist, and the patient as well. And we kind of create a plan that is specific to the patient's diagnosis and also that aligns with their goals of care, whether that is to maximize all the therapy or to make it to a special date or occasion they wish. Everything is tailored to the patient's disease, but also to meet their needs. My job is a privilege. I have the privilege of meeting people at their worst and being able to take part of that journey. So the way I approach things is I start just assessing what each family or each patient knows about what's going on, and then I fill in the gaps. I make sure that I avoid using medical jargon, and if I am going to use it, I kind of write down the words that I use, and I tell them you're going to be very familiar with these words. I also like to draw the picture. So as I'm consenting you, I'm talking to you about your surgery, I am drawing a picture of kind of what your anatomy looks like, where your tumor is, what the important parts are, and then kind of walk you through the process and what it involves in terms of the treatment options and where do we go from here. I believe that it's very important to also ask people what is important to them in life. You're not just your disease, you're not just the treatment option. It is like what matters to you and how can I help you accomplish that goal?